Welcome to Building Bulletproof Backs, where we redefine the mainstream medical approach to healing stubborn back pain. Join physiotherapist and movement addict Marian McRae on a mission to end the back pain epidemic. Building bulletproof backs requires mental, physical, and emotional strategy. Hope is not enough. Listen now as she interviews real-life back pain sufferers who have found a way out of the nightmare and introduces you to leading-edge teachers with powerful tools that can change your life. You can do this. Your body knows how to heal. You just gotta learn how to get out of its way. Now, let's get into today's episode.
Hey, welcome everyone. We are up to episode 4, and joining me today I have Dr. Simon Smith. Welcome, Simon.
Thanks, Marianne. Lovely intro.
Yeah, it needs a bit of work, but you know what? It's done, and it was cheap, and
it needs.
I'm running with it for a little while.
You've nailed it already. That is awesome.
Okay, so Simon, I'm so thrilled you've joined us. I think you're going to offer a really unique perspective on back pain. Would you like to briefly introduce yourself to the listeners?
My name's Simon Smith. I'm a 50-year-old orthopaedic surgeon based in Bunbury. My work involves hip and knee surgery and trauma surgery. I'm married with 3 lovely kids. And my hobbies are surfing and mountain biking, and I play a bit of guitar and try and keep fit with a bit of F45 at the moment.
Wow, I didn't know you did F45.
Yeah, it's getting harder as I'm getting older. But no, I've been enjoying it. I've been doing it via Zoom in the last few weeks, but we've just started up again this week doing the classes.
Oh, fab. That's awesome. So, Simon, do you want to tell us a little bit about your back pain story? How did it start? You know, where did you end up? Who did you go and see?
Yes, so I'd always had a bit of backache, which I think, most people do. But I really injured my back in Cornwall when I was 34. So there's a bunch of us playing beach volleyball, and I went for a shot where I sort of extended back and twisted, and I felt something just pop in my back, and I hit the sand, and was in a lot of pain, and I knew I'd done something pretty bad in my back. There was the bunch we're playing volleyball with were a bunch of medics and physios, and this poor guy came running across the beach and said, "Step aside, I've got a first aid certificate, I can help." And he literally had, every specialty you could imagine to help me out. But they carried me off the beach, and about 4 weeks later, I had a microdiscectomy for a big L5S1 sequestrated disc. Sorry, Marion, that's my phone.
That's all right. You're a big fan.
And the surgeon came to see me after the procedure, and the jar that he had the disc in it, and it was I'd done a fair bit of spinal surgery myself already, and it was a really big piece of disc. And although the relief of my sciatica was sort of almost instantaneous, I remember thinking at the time that doesn't bode well for my back moving forward. I knew I was going to be in trouble.
Yeah, and so your recovery from the acute pain, I guess, was fairly rapid, but what was residual?
Yes, so I mean, I was back at work I was an orthopaedic registrar at the time, and I was back at work within a few weeks. Actually, less than 2 weeks it would have been. I was back doing some work and back doing on calls within about 3 weeks. But I was left with backache and very little in terms of sciatica. It was a very successful operation for the sciatic pain. And then over the next 10 years, I just had increasingly severe exacerbations of disabling backache and pain and spasm. I was trying all sorts of conservative measures for this. I did regular physiotherapy exercises, and I tried yoga and Pilates. I had steroid injections, both facet joint injections and a steroid epidural. And I was on regular sort of simple analgesics and anti-inflammatories, but the pain and spasm in the back, despite all these conservative measures, was becoming really pretty disabling at times. And I found myself gradually giving up all the things that I loved. So I'd stop. I used to run marathons, and I'd stop running. I used to play golf, and I'd given that up. And then I found even any sort of gym activity stirred my back up, that I couldn't go to the gym. So I was increasingly becoming unfit, not through a lack of motivation, but just through the fact that anything that involved activity was causing so much pain that it just was becoming prohibitive. And then there are a few little things that sort of really sort of hammered it home that I was, I needed to really get something done that was more definitive, which for me was a surgical option. And the couple of things were, one was I was starting to find that I could barely finish my operating lists due to pain and spasm in the back. And I do remember one list where during the last hip replacement, I had to get the nurses to go and make sure one of my colleagues stayed in the theatre block, because I was in so much pain and spasm at that point that I wasn't 100% sure that I was going to be able to finish the operation.
Oh, wow.
Which is pretty serious, when you when you have that happen, it certainly makes you sit up a bit. And we had my little boy Tom was just born about 10 years ago, and I'd reached the point where I couldn't pick him up because even though he was only a few kilos, just bending forward to pick him out of a cot or to hold him, I didn't feel I could trust my back to carry, the weight of a baby.
Yeah.
I sort of, at that point, I started thinking about surgical options for my back.
And so what do you do if you're a surgeon? What do you do? How do you discover, or how do you define and choose who you would like to actually do surgery on your own spine? How do you go about that process?
Yes. So, I mean, we're very, lucky in the surgical profession, in that we do, we're well networked in terms of asking other surgeons who they recommend, and so I asked multiple other orthopaedic surgeons and orthopaedic registrars who they would recommend for lumbar spine surgery, and the same names do come up. And it's a pretty small orthopaedic community and surgical community in Western Australia. And so I ended up going to see Peter Woodland in Perth, who's got a fantastic reputation. And I had the usual sort of series of investigations and went up to see him. And even as a surgeon, I it's hard to be completely objective about whether your symptoms are bad enough to justify a major operation like a lumbar fusion or disc replacement procedure. And it's good to try and put yourself in the position of being a patient, and try not to be too medical about it, and go and see a surgeon and just let them assess you and look at your scans and then tell you their opinion on what the options are for you.
And so you were happy that he was thorough, and you were happy that the prognosis was pretty good if surgery was something you moved forward with?
Yeah, so Peter was pretty positive about my sort of prognosis with a fusion. So I had one level disease at L5S1. That disc was severely sort of destroyed, really, and then the rest of my back was pretty normal. And he felt at that level the best option was to fuse it from the front. And it did make sense mechanically to me. As an orthopedic surgeon, I'm very, very mechanical. If a hip is arthritic, you replace the bearing and it should sort out the pain. And it made sense to me that if one segment of my back was very damaged and abnormal and likely to be generating the pain, that if you fused that level and stopped it from moving, it should get rid of the pain. So Peter very much felt that I was, although it was a big surgery, he felt the prognosis was good. And that the risks for that surgery are small but significant. So I certainly didn't enter into it lightly. But I was at that point where I'd really worked hard on conservative measures for a long time, and I was continuing to have increasingly severe symptoms. And so in many ways the decision made itself for me. I think once Peter gave me that option and felt that I was a good candidate for it, the decision to actually proceed with surgery was pretty easy.
Yeah, and I think we sometimes forget that the failure of conservative treatment can actually help the process of decision making a little bit easier, can't it? It's to jump into surgery without having tried conservative measures. There's always that question of, was there another option? But when you've been through all of that and you're just really not responding, then it is the next logical step to go and get some expert advice.
Yeah, I mean, I think that we're talking about a 10-year period of conservative management, and certainly for the first at least 5 years of that, I was functioning at a pretty reasonable level. But the last 2 or 3 years, I was really functioning at a very low level in terms of what I could manage to do, and I was otherwise a pretty fit, healthy guy, and so it actually, by the time I came to having the surgery, I remember I was looking forward to it. It couldn't arrive fast enough, and the sort of the catastrophic sort of complications that can occur with an anterior fusion really weren't on my radar, because the decision had made itself, and I had no real other option. I was in so much trouble with my back.
And so tell me, Simon, in those final few years when you were unable to do the things you loved and you were in chronic, constant pain, where did you mentally end up and emotionally?
Oh, yeah. I mean, I was very lucky in that I was still able to find a lot of sort of fulfillment in my family and my work, and my sort of community and friendships. So that was enough to keep me in a very good place emotionally. And really, the main thing that was missing from my life was the ability to keep fit and do exercise and do sport. But it was once it sort of started tipping into affecting my work and my family life, I guess, that it really, I was in pretty bad trouble. And I think, I was that the last few months before I had my operation, I was very much sort of getting through the days, certainly the work days. By the time I got home, I could barely move. Which is very tough on you, I think, mentally and emotionally. And it makes a huge difference if you're surrounded by supportive partner and family and friends.
Yeah, and I guess though it also takes a toll on them, doesn't it? If you're coming home at the end of the day absolutely, done, cooked, then, that's an extra load on your partner. There's less energy for the kids. So back pain affects the whole family dynamic, not just the individual, hey?
Yeah, totally. And I think that there's, most people have a limited resource of sort of empathy and compassion, and that after weeks, when that becomes months, it's very hard on the family and the partner if they're having to pick up all the slack because you're just so physically disabled by your pain. You literally can't do anything to help out around the house with the kids. Just little things, moving a bit of furniture, carrying something, anything heavy had become, a no for me.
Yeah.
So you push your partner's levels of empathy to the limits.
Exactly. And it's not uncommon to see some relationships really suffer as a consequence of back pain. Tell me, after you've had the surgery and you had the fusion and you were slowly starting to, move again, can you remember having fear about moving?
Yeah, I had one thing that really worried me initially was that I had some quite severe neuralgic pain in the first few weeks that was in the same distribution as my previous sciatica, my S1, so going down the back of my leg to my foot, and
Mm,
it was severe, and I think it was as they pushed my L5S1 disc space open for the fusion, it did change the dynamics at the back. And I think the scarring around that nerve root from the microdiscectomy, it stirred that up. And I did have some pretty dark days there where I thought that I might have disabling neuralgic pain in the long term, and that I would trade in my backache for severe neuralgic pain, which would have been,
mm.
from my point of view, a disaster. But that resolved around the 6 to 8 week mark. And one of the things that gave me real solace there actually was at the time, a physio friend from Perth, put me in contact with a physio friend of hers who'd had the same procedure. And interestingly, he'd had very similar symptoms in the first few weeks. And just being able to talk to someone who'd been through the process and who'd come out the other side of it with that, with a good result, was hugely reassuring at the time. And by the time I got to 8 weeks, I was already feeling pretty good, and I was getting back into normal life and starting to work again. And I think for me, getting back to work and getting back to a normal routine was really good for me, sort of mentally, and the physical side of it just slowly kind of improved over a period of probably 18 months before it sort of plateaued out, really.
Can you remember your first surf back after the fusion?
Yeah, I can. so,
That
so
would have been a massive milestone, no doubt.
yeah, so Peter had told me I could surf from 6 months. So pretty well 6 months to the day, I'd arranged to go to Portugal to meet my best friends for a surf trip, and we went out for a surf. And at my first takeoff, I had a really sharp, severe pain in my back, and it really worried me, but it settled down really quickly. And then I didn't surf for that day, and then I got a longboard the next day and just slowed down my takeoff and got a few waves. And by the end of the week, I was getting lots of waves, and yeah, didn't really look back.
Yeah, I mean, surfing has a quite unique requests on the back, doesn't it? There's a lot of extension and quick movements, and it's something that even if you're physically fit, your spine doesn't necessarily go into the same directions at the same velocities as it does when you're on a wave. So I guess easing into it is certainly the smarter approach.
Yeah, and as you say, the takeoff in surfing, you do go from a very extended position with your back, and then as your front foot comes through, there's a real flick through, and your lumbar spine goes into real flexion. And
Mm.
most people with back problems don't like that fast movement from extension into flexion. It's pretty hard on the back, um, and having a stiff back again does make that takeoff maneuver difficult. Um, but I mean, in terms of surfing, this morning I've been out surfing at Helensbrook and for 2 hours, and my back's not even been on my radar, to be honest. This morning, it's the rest of me that's hurting.
And you'd take that feeling any day, wouldn't you? You'd take the feeling of muscular effort over pain any day.
Yeah, absolutely. Yeah, it's a very different type of pain.
It is. And so, when I talk about a bulletproof back, what does that bring up for you?
So I guess if I think of a bulletproof back, I think of an ideal back, a perfect back. And for me, a perfect back would be a back that's flexible and pain free. And even after very strenuous physical activity and lifting, my back would be perfect. But that for most people, I think, is unrealistic. It's the human condition almost to have backache as you age. Um, and in practice, I think a bulletproof back is a back that allows you to exercise and keep fit and keep active. And for me, it's to be able to keep up with my kids as they're getting older, and allows me to do my work without being distracted by pain.
Yeah.
Just to function at a pretty reasonable level without really planning my whole life around my back. Because I certainly, before my surgery, I'd reached the point where if people would invite me to do something or for a holiday, or the first thing I thought was, would my back allow me to do that? And that's pretty draining after a while.
Yeah. And with our current, traditional medical models management of back pain, did you know that we spend $40 billion annually on back pain in Australia?
I didn't know, and
The stats are, and it's more than cardiovascular, diabetes, and cancer combined. And, that includes things like obviously medication and allied health, but also, loss of productivity at work and all those sorts of things. Why do you think we're spending so much on back pain? What are we getting wrong?
I think it's a very common problem. I mean, as you said, it's almost part of the human condition. We're designed to walk on all fours, and we're now on our 2 feet, and our backs haven't evolved quickly enough to keep up with that. So most people will suffer with back problems at some point in their life, and there isn't just an easy solution to back pain. It's the solution is different for everyone. There's so many different options that you can try for it, that there's not a real clear algorithmic pathway for each individual. And it does mean that there's huge numbers of people out there being treated, and they're tending to get a real mixed match of different treatments, some which have got evidence for them, some haven't, some which may not work for their particular back problems. So there's not a really clear pathway, I think, for back problems.
Yeah, and I also think there's a lot of mixed messages, and there's a lot of focus on the physical aspect, the body, the disc, the joint, the facet joint, the nerve, and not so much about, the belief structures or the emotions that are attached to the experience. And, I think what I'm hoping to see is that we start giving people real practical strategies for dealing with the other aspects of the experience, where their head goes, what they start to feel, because the emotions attached to it affect the biochemistry, which then affects the ability of the body to actually heal. So, yeah, from my perspective, it's just too physically focused.
Yeah, I totally agree with that, Marion. I mean, I'm very much as a sort of hip and knee surgeon. I'm very physically focused with things. I look for severe arthritis, and then I treat it with a surgery. But with backs, a huge part of it is the emotional and mental side of it around the back problem. And if you're in a good place emotionally and mentally, and you've got a supportive network of friends and family, and you're engaged in your community, and you're engaged in some kind of fulfilling pursuit, whether it's work or something different, then you're going to be so much better equipped to deal with the symptoms from your back, and it will have a huge influence in the way you interpret and perceive those symptoms. And it's a bit like when you do a really strenuous exercise, and you're hurting all over at the end of it. You perceive that in a good way, and it's still pain, and it's unpleasant, but if you frame it in the right way, emotionally and mentally, it's a good pain, and you can actually almost sort of enjoy it. So the framing of the back pain is really important in terms of how you cope with it day to day.
Yeah, 100%. I love hearing that from someone within the mainstream medical model.
Yeah.
All right, let's have your top 3 tips, Simon. If you think back to those final few years before your fusion, and you've been on the journey and you've really experienced a whole lot of it, haven't you? What have you first of all learned from the journey, and what would you probably like to pass on as sort of 3 pieces of advice for someone still in it?
So, yes, I mean, it's a difficult question. That I think you've got to be in control and take ownership of your back problem, and I think you can't be passive about it. And so you've got to, I think, initially at least, you need to really get to grips with what is the underlying cause of your back problem. So I do think you need to get a specific diagnosis, and that means seeing appropriate healthcare professionals, whether it be a GP, your local physio, whether they then refer you for an MRI if that's appropriate. But I think you need to understand why your back is giving you trouble, and that could be a degenerative disc, it could be a your posture, it could be muscular, but get a specific reason that you understand, and then I think you need to look at what are the options for that problem, and I would always pursue the non-surgical options first, and most people with back problems don't end up going down the surgical route. You know, that if with good strategies, from good professionals like yourself, you can get on top of it without going down the surgical route. But if those routes don't get on top of it, then I think you then go down the route of seeing a surgeon and seeing if surgery is an option, because there's lots of back problems that are just not amenable to surgical correction, and then you've got to go with strategies that are non-surgical. But at least if there is a surgical option, you do know that's there as an option if you fail the conservative measures. And there's lots of non-surgical options that can provide really good relief, whether it be sort of interventional type things like injections, whether it be rehab type interventions, physio and working on core and flexibility. For me, just having access to simple painkillers such as paracetamol and anti-inflammatories, that was a huge benefit. Just making sure I always had some basic pain relief available when I needed it. And the final thing, I guess, for me, I think really trying to maintain some physical fitness. I think trying to keep your weight under control. If the back is not allowing you to go to the gym, then maybe you try a bike. If you can't go on a bike, you maybe get in a pool. But finding some way to keep some fitness and keep moving, I think that's really important.
Yeah, and sometimes I think just, being able to walk through nature for 5 minutes, you know, whilst it might increase your back pain 1 or 2, the mental and emotional benefits of just feeling like you can still do some things outweigh some of the pain scale increases. So, the pain can't dictate your life. And there's a lot to be said for sometimes just feeling more normal. Like you say, finding some relief in a few pills, feeling engaged in what you do, and social networks. They're all aspects of our health that are cheap, are free, are portable, are easy, but under prescribed. Hey.
Yeah, and I totally agree with that. I think the point is that most people do have back pain in their life, even if it's only for a short period of time at some point, and accepting that you're going to have some back pain when you do an activity is it's not a bad thing. I mean, you still should go out and try and do the activity if the back will allow you to do it. I mean, going for a coast walk, down in Margaret River, just 20 minutes walking on the coast is a fantastic thing for your mental health and your physical health. And you may be sore on your back at the end of it, but it's worthwhile. The benefits outweigh that extra bit of pain in the back.
Yeah.
So I think sitting.
We're pretty lucky down here, aren't we? with options?
We're spoiled in Western Australia. We live in one of the most beautiful places in the world, and there's so many options to get out there and really sort of stimulate yourself mentally and emotionally. That I think that's important, and it's a very holistic way to deal with it, rather than sort of sitting at home and dwelling on the pain, which can often lead to a pretty downward spiral.
Yeah. Hey, Simon, thank you so much. I've really enjoyed hearing about your story, hearing your advice, hearing your perspective. Really refreshing. We haven't had the surgery discussion at all yet, so that's a really good one to tick that box, I think. Thank you.
Our pleasure, Marion. I hope that someone finds something worthwhile in our discussion that helps them with their back. I can certainly empathise with people who are struggling with their back.
Yeah, and I think you touched on it when you said those first few days after your surgery, talking to the physio friend of the physio who'd been through it and could reassure you that it settled down for them. I think hearing those messages gives us confidence that, okay, this is maybe not going to be around forever and I can move through this. And the more we hear that other people have done it, somehow it makes the process a little bit more normal and achievable for ourselves.
Yeah, no, I totally agree. I mean, you've got to remember that most people are going to have problems with their back at some time, and most people get through it and come out the other side, and they usually reach a point where they're happy and they're functioning at a level that is fulfilling, and people reach different levels, but you can still find a lot of well-being and fulfillment without having a perfect back.
Yeah, that's a great message. I love it. All right, my friend. Well, I'm going to let you take off from Coarum Car Park.
Thanks, Marion. Great talking to you.
You too. Thanks, Simon. And I hope your back remains well and vital. It sounds like you're on the right path.
Fingers crossed.
Okay. Catch you later.
Cheers.
Thanks for listening to Building Bulletproof Backs. To learn more about Marion's unique 8-week Building a Bulletproof Back online course, visit the link in the show notes. You will receive a step-by-step system providing mental, physical, and emotional strategies for smashing your back pain to the curb. Ain't nothing like this anywhere else on the market. Become your own hero.